Welcome to Doc Talk Live. This is an impromptu Doc Talk Live. This was not planned today. We didn't have this scheduled. I'm with my partner, Dr. Meg Gilmer. If you catch, let's say, the rebroadcast of this show, or you're new to Doc Talk Live, let me just tell you a little bit about what this is about, which is to say that I am trying to do live videos about health, about medicine, and I want it to be ultimately interactive so people can type in questions. With me today I have Dr. Gilmer. Meg, I appreciate you coming on today.
Absolutely.
And doing this. Meg is a foot and ankle specialist, and Blake, I'm going to get you to even help me with this today. Blake, by the way, is filming this, but apparently, I didn't watch the football game. Apparently, in the Alabama game, the quarterback sprained his ankle. Is that right?
That is what we've been told.
Okay, so I'm going to let you take it from there, Meg, because I don't want to show my lack of ignorance for football. But this is a big football state we're in, and everybody's into these various injuries. So tell us a little bit about the quarterback and what happened.
Yeah, so Tua Tagovailoa has a history of ankle issues. He's already had one side last year that he injured and had to have surgery on. And then on Saturday, he sustained another injury to his opposite ankle. He was able to walk off the field, which was an improvement over last year, but the reports from Nick Saban say that he in fact had surgery yesterday, and they did a similar procedure as to what they did last year, which is called a tightrope. And that is for an injury between the fibula and the tibia, which are the two ankle bones. And this is an MRI, not of Tua, just so we all know that. But this is your fibula, which is the small bone on the outside of the ankle, and this is the tibia, which is your shin bone. This white is fluid between the two bones. You're supposed to have a ligament that runs between that and no fluid tracking up there. You can see here, this is actually the ligament, and it's not supposed to look like a thin black line. And instead, you've got a lot of gray, it's swollen, which indicates that ligament has been injured. This is what we call a high ankle sprain. These are historically harder to get over than a traditional low ankle sprain, which is what most people get when they're walking and they just roll their ankle. So, without seeing Tua's MRI, we're going to go off the reports that he had a high ankle sprain, and they did the tightrope for that.
And they did a tightrope procedure. So
correct.
Tell us what a tightrope procedure is.
So what a tightrope does is it's connecting or reestablishing the connection between the two bones here. So you drill, and this is here, you drill holes through the fibula all the way across, and you run the tightrope device across, and it has this little button on this side that you then tighten over here. So you wiggle it back and forth to tighten that up. So you bring those two edges back, or two bones back together, and stabilize that torn ligament.
So again, let me back up. If you're just tuning in, if you're coming into this on our live broadcast, I'm with Dr. Meg Gilmer, and we're specifically talking about Tua, the football player, the quarterback who sprained his ankle. He had a high ankle sprain, and this is a tightrope procedure. Now, if people have questions and they want to, the goal is for this to ultimately be interactive, or if this is a rebroadcast and you have questions, just try to type those in or comments, and hopefully I can track down Dr. Gilmer and I can get her to answer those questions as well if it happens later. So this looks like a very slick idea. It's like putting an ankle brace on the ankle on the inside.
Correct.
Now, my understanding is this guy is the key to the team, right? So if they don't have Tua, they don't have a team.
Largely.
Yes. So how soon does he come back, and what's the recovery from this type of surgery?
So the good thing about this surgery is you're actually able to put weight on it immediately. So he's in a walking boot. He's able to tolerate putting weight on it, and his trainers are working with him starting today in terms of getting his ankle mobility back, keeping that strength up. But the biggest initial limiting factor is the incision. You've got to have your skin healed or you can't run around on a football field because you're just risking opening it up, infection, things like that. So generally speaking, the skin itself is a limiting factor for 2 weeks.
Interesting.
After that, it really depends on how his rehab goes. Surgery, injuries, all of that mess with something called your proprioception, which is your brain's ability to control your feet. And so in his rehab, he's spending a lot of time doing balance work and strength to try to get that connection reestablished. It's really hard for me to say that he's going to be 100% for the LSU game in 3 weeks because of that connection. I think the ankle will tolerate it. It's a question of does he trust it yet? And is his brain able to tell him how to do what he needs to do to be the Tua we know?
So is he a running quarterback or is he a throwing quarterback? And if he's like a step back in the pocket guy, he could be fine.
He's both, but because of the mechanics, when you step back, so if you do a drop, you have very specific footwork for a 3-step drop, a 5-step drop, or a 7-step drop. And so you've got to make sure your feet are going where you tell them to go. And more importantly, he's a lefty, okay? So when he throws, like normally when you throw as a right-handed person, you step left foot into the throw and across.
Right.
For a left-footed person, or for a left-handed person, you're stepping right and transmitting power across. And so he's got to trust that plant foot. And more importantly, in his head, he's got to be able to ignore the fact that he's just had surgery and there are 4 or 5 very large people trying to tackle him. It makes for a very difficult situation for him because he's got to be able to tune all of that out in less than a few weeks. And it's still sore. I mean, it's surgery, even though it's a small surgery.
Are there any questions on there? Or are we good, Blake?
I haven't seen it yet.
Go ahead.
Is it a percutaneous type surgery, or do they make an incision?
You make an incision. It's usually about 1 inch long.
Okay.
And you do have to dissect down to the bone. So even though your ankle bones are fairly close to the surface, you're still having to get to them. So you have some soft tissue trauma and some pain with that. And like I said, the skin itself on everybody takes about 2 weeks to heal, to be able to tape up enough that you could play.
Now, I understand there's another quarterback injury out there that involves the foot. Is that right, with Cam Newton?
Yes.
Is it Cam has a foot injury?
So he has a Liz Frank injury,
He has
correct?
a Liz Frank injury.
So now we'll switch from Alabama to Auburn. Okay. But he plays for who? The Carolina Panthers, right?
Correct.
Okay, so he has a Liz Frank injury, which is why I pulled out this sort of quasi-model.
Yes.
Can you talk to us about what a Liz Frank injury and how Cam hurt his foot?
So a typical Liz Frank injury occurs between this part of the foot. So this is what we call the tarsometatarsal joints. And there is a ligament specifically that runs between this bone, which is your medial cuneiform, and the second metatarsal, and it runs kind of in this oblique direction. It is the cornerstone or the ligament that controls the arch that goes across your foot over the top of the foot. And it typically is injured, and in football, when you are planted, you're up on your toes and you're planted, and then somebody lands on your foot. So it's an axial load. So somebody comes in and just crams your foot into the turf. And so it's almost like a wishbone where the first metatarsal is going one way and then the second metatarsal is going this way, and it splits and tears that ligament. The problem with a Liz Frank injury is that ligament is not likely to heal on its own. Okay, we can immobilize it, cast it, and try. But if it is completely torn, most of the time the correct answer is to do either an open reduction internal fixation, try to hold it all together while it does try to heal, or to do a fusion to recreate that stability so that you have a good solid platform to push
So
off.
unlike the ACL in the knee, which we recently talked about, it's not like you can repair that ligament. You've got to basically fuse those two bones together.
Correct, because that ligament is only about 3 millimeters.
So it's
in
very,
length. It's
very
small.
So what did Cam have?
Cam has not had anything.
Okay.
Oh, really?
He has been immobilized. They have been trying to get it to heal without surgery. Because my understanding is if they're doing that, he's only got a partial tear. So you can tear, it's a big thick ligament, so you can have partial tears, which may heal enough to play on again. But they're trying to get him back this season, and any of those surgeries mandate 3 months of non-weight bearing at all. So that would completely finish his season, and oftentimes, truthfully, at the level in the NFL, it finishes careers.
Wow. So why does it finish a career if you have surgery? It's just not as good as the ligament itself.
Well, it's not as good, but it's also about your downtime. You know, if you've got 3 months of completely off your foot, non-weight bearing, no matter how good you are in terms of your rehab and recovery, it's not going to, you're never going to be quite as strong as if you've been able to train through all that time. Your leg muscle stays relatively
But
atrophied.
if he did it in the off season, I would think he'd be able to come back.
They do, and they've tried.
But it just doesn't.
But it doesn't seem to.
Okay.
It's a lot like an Achilles tear.
Okay.
A few get back, most don't.
Okay.
It's kind of like a lingering issue throughout,
Correct.
especially at that level.
Because your
where
mechanics are no longer quite the same. And Cam, in particular, is a running quarterback. So a lot of his game is being able to take off and go with speed. If he were more of a Peyton Manning who played with 2 bad ankles, you could get away with it because Peyton didn't move in the pocket.
So do we
Cam
have
does.
any more football injuries that you want to talk about today while we're on it? I have lots of foot topics that I've been dying to schedule you for because I'm just going to take off my shoes and socks one day and we're just going to go through it. But any more football injuries that are in the media? Not, because I don't know.
I don't think there's anyone that's
Standing
super current
Profile.
from
Okay.
a foot and ankle perspective right now.
Okay. So if people have questions later and they see the rebroadcast,
So I've got one back to Tua. Recovery time and restrictions, and is this? Can he come back too soon from this and really damage himself later on down the line? I mean, he's projected to be the #1 overall pick in the draft this year. I mean, he's high profile as they come.
Right.
So what is he looking at futuristically down the road? I mean, is this?
So
Let me just repeat that question, just because the mic is facing us. I guess the question is can he do more damage by coming back too soon and harm his chances of being the #1 draft pick because of that?
What is the appropriate recovery time and restrictions? If this were your patient that come in,
Because you said earlier that it's mostly just getting the skin to heal.
at this level.
Right.
I think really and truly it's not the surgery that's going to be the question for him getting back. Does he have good control of his ankle? Is he going to be able to push off on it? Is he going to be close enough to 100% to be able to make the throws, to be able to escape and run around when he needs to? Or is he going to be sacked 5 times and get re-injured because he can't move? So I think that's really going to be the question for the 3 weeks, with the LSU game, because that's what everybody's freaking out about is the LSU game. I think if it were my patient and I had a choice in terms of, is it desperate and dire circumstances to get them back, I would like to give them 6 weeks because that gives them a lot more time in therapy. It gives them a lot more time to be that 100% that you want. It's a little different when you're playing and your Heisman hopes are on the line, your draft stock's on the line. So there's some different circumstances for him than you would for somebody who is, say, a 16-year-old high school athlete. It's not their senior year. It's not their scholarship season. You have a different take on it. My worry long term, and this is something we have not yet completely studied over the years with this particular type of
'Cause
device.
this is kind of a new procedure, right? I mean,
It's actually been
last
around
couple-
for probably 10 or 12 years.
okay.
Mostly it was at first used in the presence of ankle fractures so that you could avoid drilling more screw holes across. It's gotten more and more trendy with sports injuries, trying to get people back on the field faster, and the idea of prevention of future injuries.
Okay.
What we don't know, and I'm not sure there's a study out there yet, so you think about it, these are holes through the bone, okay, in both places. Now they're drill holes, so there's bone completely surrounding it, but you now have two weak spots in the bone. This is now rigid and pretty strong. This is now the weak spot. Yes, it's multiple crossings of fiber wire. But now this is your weak spot. So instead of the syndesmosis giving, you're more at risk for a fibula
Well, why
fracture.
couldn't they have put the holes here?
They are there, so they go all the way across.
Okay, so but this is the weak spot because this bone is so much stronger.
Correct,
Okay.
because of and this is where most people are going to put their forces. When you roll your ankle, generally the fibula is the bone we break.
I've
The
done
other
that.
thing, yeah, we've all done that. I'm
No,
afraid.
seriously.
The other thing,
I have 8 pins in my fibula.
Yeah. And then the other thing we worry about, and we don't know the consequences of this yet, how do we gauge our tension here?
How do we know how tight to
How
make it?
tight to make it, and we don't know 30 years down the road if we over tighten it, what are the consequences of it? We suspect it's post-traumatic arthritis, but we don't have a 100% study that correlates the two. So some of it is finding the right tension. Sometimes you get lucky, sometimes you may over tighten it, but we don't have a gauge to know what that is.
Do they ever take this out?
Not usually, because you now have the holes to fill. And so you leave them unless they break around them or something happens.
Like if I got my hardware removed here,
Mhm.
I would have all those holes.
Correct. And over time, your body will fill those holes in. But if you're talking about in season and you're going to go play, you now have 8 holes that are weak spots in that bone
Sure.
until your body has time to heal all of that.
And is it likely could he tear those fibers? I mean,
The tensile strength on those are much stronger than the actual native ligament, so it would probably take something like a car accident
wow.
to tear those. And quite frankly, you're going to break the bone first.
Meg, I want to thank you again for doing this, and I want to also get you to come back when we can let people know we're doing it, and
Yeah.
so people could have their questions ready so we can talk about other things like plantar fasciitis, bunions, metatarsalgia, Morton's neuroma, tarsal. What are some common things that foot and ankle surgeries see a lot of?
So plantar fasciitis is number one. It's that 1 in 3 people over the course of their lifetime will have plantar fasciitis. So hands down the number one thing we see.
Okay.
Probably number 2, and same root cause, is pain in the front part of the foot. Particularly, people find as they get older, they want to get up and put their shoes on because their feet are sore when they get up. Same reason, believe it or not. So as a teaser, the Achilles may be the root of all evil in the foot.
Nice. Nice. Okay. Well, thanks, Meg. Enjoyed it. Appreciate it. Thanks, Blake.